started. Hello and welcome to this evening's webinar about neuropsychological evaluations. I'm Jane Hauser. I'm the Director of Marketing and Outreach at NESCA. Thank you so much for joining this afternoon or evening. I am joined by Dr. Ann Helmus, who is the founder and director of NESCA, and she's also a clinical neuropsychologist. She will be guiding you through a presentation all about the ins and outs of neuropsychological evaluations, reports, and also what to look for in a neuropsychologist. Before we start, just a couple of housekeeping items for you. We'll all be muted throughout the webinar, and we will be running a live Q&A at the end of the presentation. We've enabled the Q&A function at the bottom of your screen. So if you have questions, feel free to put them in there throughout. Just know that we'll hold off until the end to answer those. There is a chat feature. We ask if you have any kind of technical difficulties that you put those in there. And if you miss anything, we will be providing a recording of this on our website in just a couple of days. So with that, I will turn it over to Dr. Helmus, who will introduce herself and get right into the presentation.
Great. Thank you so much, Jane. And thank you to all of you for spending your warm Wednesday evening with us. I was just reflecting that in September, I will hit my 30th anniversary of being a neuropsychologist, which is really sort of hard to believe. But I'm thrilled to have the opportunity to talk with you about my life's work. Whoopsie, why is this not working? Here we go. So I wanted to start off with talking about some sort of common referral questions, which is why would somebody seek a neuropsychological evaluation in the first place? And I think sort of globally what we can say is that people will often seek an evaluation for a child when they recognize that a child's unable to meet some level of developmental demands. So whether that's self-control in a first grader or the ability to work independently in a sixth grader, could be social demands, academic demands, but that the child is not developing in the way that the peers are. Another reason that we often see kids is because there are problems with specific skill acquisition. So a kindergartner or first grader who's not mastering the early stages of reading would be a good example of that. We see a lot of kids for evaluations who are observed to have attentional issues or organizational issues. We'll be mentioning executive functioning a little bit later. That's another big reason that kids get referred. We see kids who have emotional issues, that they're presenting with depression or anxiety or school avoidance. And we want to understand what's going on emotionally, but we also want to understand if there's something else going on that might have led to those emotional issues. So for example, kids who show school avoidance behavior, a lot of times it turns out that they may have a learning disability that hasn't been diagnosed. And so one of the reasons they're avoiding school is because it feels so hard for them. And so it's important to understand, are there things linked with the emotional issues? Certainly social skills issues, children that struggle with their peer relationships often will cause a referral for neuropsych evaluation to figure out why, what's getting in the way. Is it that the child can't control their impulses and so they alienate other kids? Or is the issue that they can't pick up on social cues, nonverbal cues? Do they have poor communication skills so they can't communicate with their peers? There's a whole range of reasons why kids may struggle socially, and a neuropsychological evaluation helps us to sort that out. Children who have neurological or medical disorders that impact brain functioning are often referred so that we can see what the sequelae of those disorders are, what the functional deficits may be in a child, and help to make a plan. Oftentimes we have children that come back on a fairly regular basis, like maybe every 2 years or so, and those kids are coming back just to monitor progress. Oftentimes we've given comprehensive recommendations about what to do, helped families to access the services that they need, and it's good to repeat the neuropsych testing maybe 18 months, 24 months after that to make sure that the things that we've put in place are working, and to anticipate what's the next thing that we're going to need to do as the child continues to move along in school and continues to grow up. Which brings me to anticipating demands during educational transitions. So we see a lot of kids at the end of their elementary school where parents are thinking about how are they going to function more independently in middle school. We see kids at the end of middle school anticipating transition to high school, and then many kids we see later in their high school career thinking about the transition to young adulthood, to post-secondary education, and just wanting to get a picture of what their strengths and weaknesses are and what their needs are. So when somebody comes for a neuropsych evaluation, what do we learn from the evaluation? And one of the things I think that's really important to say is that the purpose of the evaluation is not to figure out what diagnostic label can be attached to a child or to pigeonhole them into some sort of disability. I'm as interested in knowing what a child's strengths are as what their weaknesses are, and how we can use the strengths, leverage the strengths to help them to compensate for their weaknesses or to improve their areas of weakness. So that being said, oftentimes what we'll find if a child's having difficulty in some area is that they may have a pronounced learning style, meaning that as long as information is presented to them visually, they get it right away, but they may struggle more to process language, would be an example. If their ability in that example to process language is significantly below age level expectations, then we might even diagnose them with a learning disability. And so that would be a more sort of severe case than a learning style. Another outcome would be to find that a child has a neurologically based problem with attention or executive functioning that's getting in the way of their social development, their academic progression. Another outcome would be that the child has either a full-blown emotional disorder, like an anxiety disorder or depression, or is just experiencing a high level of emotional distress. I can tell you that this is probably one of the most popular things that we're seeing now during COVID. Lots of kids who are really, really distressed emotionally, and way too many transitions and that kind of thing. Autism spectrum disorder is a diagnosis that we often make as a result of a neuropsych evaluation. And sometimes we go through the whole process, which I'm going to be describing to you. And really what we need to do is just reassure parents and say, you know, it's normal for 8-year-olds to have fears. That's not an anxiety disorder. That's just sort of part of normal development. And there's nothing here that makes us think that there's anything going on that needs any sort of special treatment, anything like that. But what we can give back to parents is to say, given who your child is, here are some strategies for parenting. Here are some things I would be thinking about educationally, and so on. So this sort of goes along with what I just was talking about, that the benefits would be that you can understand a child's learning style so that you can determine what would be their best educational program. In order to access special education services, you have to be able to document a disability and know what it is that you're asking for, which is a whole part of the neuropsych evaluation. Another would be to understand the interplay between emotional and learning issues. So just a really concrete example of that would be, is the child anxious because they have dyslexia and it's really hard to not be able to read when you're in the 2nd grade? Or does the child have a primary anxiety disorder and that's what's making it hard to learn how to read? And so it's kind of the chicken or the egg question. And that's an analysis that we can easily do as part of the neuropsych assessment. And then I would say most importantly, that what comes from the neuropsych assessment is a treatment plan. And I think one of the things that differentiates the evaluations that we do at NESCA from some other places is that what I often see in neuropsych evaluations is that there'll be 3 pages of recommendations. And a lot of them are sort of generic recommendations that aren't really geared toward that child or that child's situation. And myself being a parent, if I got 3 pages of recommendations of things to do for my child, I would probably just give up before I even started. Or I would pick the 1 or 2 that I felt like I could do. It's not a very effective tool, I don't think. And so what I try to teach the neuropsychologists here, and what we try to practice here, is to really craft a plan what is the most important thing that could be happening at home? What are the most important things to be happening at school? And let's focus on that, and let's make it doable, and let's make it meaningful, and not just give 3 pages of, here's 5 books that you could read, and here's 10 accommodations that you might want to do, and so on and so forth. So I would call that the difference between a treatment plan and just a bunch of recommendations. So I used to have, this slide used to be called Neuropsychological Assessment is not like a blood test, but now keeping up with the times, I've changed it to it's not like a COVID test. And what I mean by that is that when you get a COVID test, it's either positive or negative. And it doesn't really matter, what mood you're in when you get the COVID test. It doesn't matter what mood the evaluator is in. It doesn't matter if you can pay attention or you can't pay attention. Nothing matters. The test just gives you the result. And that is not true for neuropsychological evaluation. The scores don't speak for themselves. And so we could have 2 kids that have the exact same scores, and they could mean very different things. And in order to understand what they mean, we often have to integrate a lot of other information. So what's an example of that? So we have a test called block design. And the way that block design works is that we give the child a pattern, and we give them 9 blocks, and they have to recreate the pattern with the blocks. A lot of kids who have ADHD will work their way through the first, let's say 7 or 8 blocks maybe, and then they start losing interest, they stop paying attention, they want it to be over, and so they don't pay any attention at all to the 9th block. So they may have 8 blocks that are in the correct place, and the 9th block is rotated, and they get a 0 on that design. Then we might have another child who has a significant behavioral regulation problem. That child comes in and starts flinging the blocks all around the room. That child also gets a 0. So both of these kids are earning a 0 on this particular task item, but for very different reasons. The ADHD kid appears to have decent visual spatial skills, but doesn't have staying power and can't pay attention. The child that has no behavioral regulation, we don't know anything about their visual spatial skills. What we do know is that their behavioral regulation gets in the way of them being able to carry out tasks that we want them to do. And so in this way, the scores don't speak for themselves, and it's really important to have the behavioral observations in order to understand how somebody achieved the score that they achieved. So in order to help you understand the sort of mindset of a neuropsychologist, I wanted to talk about the reasons for attentional problems. So if a parent brought a child into me and said, my child is having attentional problems, he probably has ADHD, right? I would say, I don't know. Until we do the evaluation, I don't know why your child has attentional problems, because there's many, many reasons why your child could have attentional problems. And I've made a list here, which I'll just go through relatively quickly. So the child could have ADD, which basically means that there's some neurological dysfunction, most likely in the frontal lobes, that make it difficult for the child to pay attention. Another reason a child could have difficulty paying attention is sensory issues. Children who haven't had their hearing tested, children who need glasses, often will have difficulty paying attention in class because they can't see well or hear well. Kids who are struggling with emotional issues. All of us know that when we're feeling depressed or anxious is not when we can concentrate on getting our income taxes done. Same thing is true with kids. Childhood depression is a very real thing. Anxiety disorders pervade children, especially into adolescence. And when kids are experiencing significant emotional issues, they have difficulty paying attention. Kids who are undergoing a lot of stress, their parents are getting divorced, they don't like their teacher. Kids who are intellectually gifted often will have attentional problems because the pace of school feels too slow for them, and they may already know a lot of the content. On the other end, kids whose cognitive ability is not at the level of their classmates may have difficulty paying attention because the pace feels too fast for them and too sophisticated. Children who have postural instability, so they don't have the spinal control, the back control to sit up in a chair, will be constantly shifting around, trying to get comfortable and not paying attention. Kids who have language processing problems, who don't comprehend language well will tune out because there's too much language and they can't make sense of it. Kids who have slow processing speed, again, the pace is too fast, so they tune out. Kids with Tourette's disorder, which is a tic disorder, are known to have attentional problems. Kids who are in pain have attentional problems. Kids who have a history of trauma, neglect, or abuse often have attentional problems. And then one that I didn't put on here, which I should have, or maybe it's here. No, I didn't put on, is autism spectrum. Sometimes kids who are high functioning on the autism spectrum are misdiagnosed as having ADHD. And so sorting out whether it's autism or ADHD is really important. So how do we determine if the child comes in with attentional problems, and I just gave you a list of probably 15 reasons why a child could have attentional problems, how are we going to figure this out? There is not a test for ADHD that we can just give. We have a whole bunch of tests, but there isn't one specifically for ADHD, just like there's a test for COVID. So we rely on three major sources of information. We want to get as much information as we can about the child's history, how they developed, if anything is going on medically, what their educational journey has been like, and what the family history is. Many of the things that we see have a high genetic load. And so that, for example, if you have a lot of family members who have had anxiety disorders, chances are the child may be vulnerable to an anxiety disorder. Then we rely very heavily on observations. And so I gave you sort of an extreme example of a child throwing all the blocks around the room versus a child who just sort of lost interest. But as I often say to the postdocs that I train here, the evaluation starts in the waiting room. From the minute that we get out there, we are observing. Does the child orient to us walking into the waiting room? Does the child greet us when we greet the child? So on and so forth. Does the child pick up on nonverbal cues? We also want to get the observations of the parents and the observations of the teachers and understand how the child looks in different environments. Is it the same or is it different? And then finally, with testing, we want to get testing scores, and we also want to understand the process by which the child achieved that score. And so all of this information gets integrated. And in some kids, some of the information is more important than in other kids. So for example, one of the clinicians at NESCA recently tested a child who was selectively mute, meaning that he didn't speak to her the entire time of the testing. And the parents said, well, how can you possibly get any information? And for her, just by going with history and observations and collecting a lot of data from teachers and other professionals working with this child, she was able to formulate a really good treatment plan for this family. And in that case, there was almost no testing scores because the child wouldn't cooperate. Okay, so when we're doing this assessment, and again, I use the word assessment, not testing, because we are assessing all of these things from multiple standpoints. So for example, if you take academic achievement, one way we assess where a child is academically, let's say what their math skills are, is that we give them a standardized math test and we see, do you have 4th grade level math skills or 8th grade level math skills? Another way that we assess a child's academic achievement is to find out what the teachers have to say. Do the teachers think that this child is a good reader or a good math student? And if those two things correspond, then we feel pretty good. So if I give a child standardized mathematics assessment and they do really well on it, and I look at the teacher questionnaires and the teacher says, oh yeah, this kid is above grade level in math, then I'm ready to check the box to say, I think this child has great math skills. If I find that the child tests really well in math and the teacher says this child is struggling in math, we got to figure out what's going on here, because it looks like they have the skills, but somehow the skills are not showing up in the classroom. So, so assessment means we are trying to understand all of these areas of functioning through our standardized tests, through information that other people have who know the child well, who see them on a day-to-day basis, and their history. So, so the actual evaluation process starts off with a review of records. And so what happens when a family calls and sets up an evaluation at NESCA is that we will send them a bunch of questionnaires, ask them to get the IEP, give questionnaires to teachers, send us all previous testing, and all of that comes in before I ever meet the parent or the child. So just by going through all of the records already, I'm forming some hypotheses about what might be going on or ruling some things in or out, just based on that. And so then the parent comes in for a 1-hour meeting. And when we meet, I'm trying to clarify information that I've read, understand what their sort of chief concerns are, understand what their comprehension or their perception of the problem is, and really also understand what goes on in this family. What are the stress points and the demands on this child in the family, and where are the areas of support for this child in the family? And then the same thing at school, because we're not testing children in a vacuum. I'm not thinking about children in a vacuum. Children are members of their school community and they're members of their family. And so understanding those environments is really important. And, final part of the parent interview is really trying to build rapport and trust with the parents so that we can work together on behalf of the child. So in terms of testing the child, I strongly recommend that you do testing on 2 different days. A lot of places do one sort of full day evaluation, which has the advantage of efficiency, but I think a lot of kids get really tired after 2 or 3 hours of testing. And so I'm not quite sure, how the afternoon results are in a situation like that. The second thing is that we like to see how does a child respond to a new environment the first time they come in, and to an environment that's more familiar with them. And sometimes there's no difference whatsoever, and in other kids there's a marked difference. So anxious kids often will be much more withdrawn and anxious the first time they come, and maybe warm up and settle in a little bit on the second testing session. Kids with ADHD will be the opposite. Kids with ADHD seek novelty. And so on the first testing session, they're all amped up and ready to go. And it's a new person and a new environment and new snacks. And then on day 2, they're like, oh yeah, I've been there, done that. This isn't so exciting. And they sort of tune out. So it is great, I think, to do it on 2 different times. One of the things that I think is really important, because these behavioral observations are so critical, is that you want to have a senior or experienced neuropsychologist carefully involved with the testing. And some centers will use testing technicians, which are not psychologists. They're just people who have been trained to administer the tests. And the neuropsychologist just looks at the results and talks to the parents. They may have had very little contact with the child. Similarly, postdoc fellows, which are psychologists, but they aren't very experienced. They're supposed to be getting their training, or interns, which would be even less experienced. So, and NESCA used to have postdoc fellows. We don't anymore, but when we did have postdoc fellows, we always had a neuropsychologist in the room with the postdoc. And so we had the benefit of 2 sets of eyes. So I would really ask questions, very direct questions about that. And another reason why it's important to have somebody senior there is because we use the testing sessions to figure out what supports are necessary. So just as one example, there's some kids that get really overwhelmed if there's too much on a page, and they get anxious and they sort of, kind of can't function. They either get paralyzed or they sort of melt down. And so what I might do with a child like that is to cover up half the page. And I'm looking to see, by my covering up half the page, was this child able to meet the demands of the task? Yes or no? And if the child is, then that becomes a recommendation that we need to put less visual stimuli on the page, as an example. And most testing technicians are not trained to do something like that. And another really important reason to have a more senior person in the room is that I start right from the beginning working with kids to reflect back to them their strengths and their challenges, all in a very accepting way. Like, wow, you have an amazing vocabulary. I can't believe you knew those words. Those are like words for 7th graders. And to point out challenges and say, seems like math is just really tough for you. So that the child can see that I'm seeing them. And one of the reasons I want to do that, beyond just getting to know the child and makes my job much more enjoyable, is that with all kids, we assess their emotional functioning toward the end of the time that we're together. And so you have to build up a level of trust where a child feels like you see them, you appreciate them, they can trust you, you're on their team, and that sort of sets the stage for them to hopefully share kind of what's going on emotionally for them. So once we've done the testing, which is usually about 5 to 6 hours over preferably 2 sessions, sometimes with little kids we'll do it over 3 sessions or 4 sessions, whatever's necessary. Then we have about a week later, the parent feedback session. That's an hour and a half, just the parents, and we explain what we found. And this should not be a recitation of test scores. This should be talking about their child and what we figured out about the child's strengths and weaknesses, why the child is struggling in whatever areas the parents have noted that they're struggling. To talk about what are the risks that are associated with this profile, which we'll talk about a little bit more. What are the treatment options and recommendations? Parenting strategies, educational planning, all of that. And again, that I believe that it's a neuropsychologist's job to prioritize this and work with parents around what are the most important cost-effective things that you can do for this child. And if you get all these things rolling and you want more, give me a call. I'll be glad to give you, further recommendations, but let's not get ourselves overwhelmed for parents or the child. And so, as I mentioned, we're just reviewing test scores as relevant. Parents aren't there to understand scores, they're there to understand their child. So what is a pediatric, whoopsie, sorry about that. What is a pediatric neuropsychologist? It's a doctoral level psychologist. And so they could have any one of these 3 degrees that is listed here. This is not a hierarchy. It's not the case that one is better than the other. They're just different paths that people can take in order to become a licensed neuropsychologist. And in addition to obtaining their doctoral degree, during which time they will have done internships, they also need to do at least 1 year of supervised postdoctoral training in pediatric neuropsychology. I made this slide a couple of years ago when I said this field is moving toward a 2-year postdoc. I would say the field is there. The field has arrived at a 2-year postdoc fellowship. Why is this important? It is critical. And the reason it's critical is because in the state of Massachusetts, there is just one license for all psychologists. So I spend all of my time doing pediatric neuropsychology. I have the exact same psychology license as somebody in Cambridge who spends all of their time doing sex therapy with adults. Same license. So what that means is that there are people out there who are Ph.D. psychologists who say that they do neuropsych evaluations because they bought all of the materials, they learned how to administer and score the tests, and they often don't know how to interpret what they're doing, or they don't know how to interpret the results very well. And, I hope that at some point we have specialization licenses so that you really have to prove that you have the training in whatever field that you're in. I mean, nobody would want me doing marriage counseling, I can tell you that, even though theoretically I could do that as a psychologist. So it's really important if you're interviewing neuropsychologists to say, tell me about your postdoctoral training. And they should have a formal program, not just, in my year after I worked with a neuropsychologist. No, formal postdoc training means you had seminars, you had training, you had supervision, all of that. Very, very important so that we know that somebody has the proper training. So I think you're probably getting that I believe that all neuropsychologists are not the same. That's true in every profession. Not all accountants are the same. Not all lawyers are the same, and so on. And I think what sets the great neuropsychologists apart from the ones who aren't so great is that anybody can administer and score these tests. I mean, I literally could probably teach a middle school child to do this. But the issue is, how do we interpret these test scores in the context of the behavioral observations and historical information that we have? Another thing that sets apart neuropsychologists is the skillfulness in making good, meaningful recommendations that will actually work for the child. Because at the end of the day, that's the point of the whole thing, is to figure out how to help the child. And so if you can just give a bunch of generic recommendations like a child with ADHD needs preferential seating, I don't think you've contributed a lot. A big thing is also, can we assist the families in implementing the recommendations? So I've seen many families who come in and say, we were recommended for a specific type of therapy or tutoring or something like that. And then when I asked the doctor, how can I find a person who does this? They said, oh, I don't know, that's not my job, but I'm telling you what you need. I believe that it is, incumbent upon the professional to help make those connections and to maintain networks of professionals in other fields, to understand the IEP process, to have some political savvy to get things done, and to work with families, to work with schools, to work with other professionals, but to really help get the recommendations implemented. Otherwise, again, they're worthless. This should not be just an intellectual exercise. This should be helping a child to move forward. So I one time went to this hairdresser who said that her specialist was fixing botch jobs. And so this was the place that you would go, like if you went somewhere else and they just completely messed up your highlights. And so now you had to go and get everything stripped out and start all over again, which is much harder than just doing it right the first time. And I feel like sometimes that's true at NESCA. I feel like a lot of times we see families who are really disappointed in what happened the first time around, and we're trying to sort of tease apart and figure out what's going on. Getting the incorrect diagnosis is obviously a huge problem, because then you're going to be setting off on the wrong sort of treatment plan. And that treatment plan could be ineffective for the child, or it could actually be harmful for the child. If your child is incorrectly diagnosed with ADHD and you're suggested to go see a psychiatrist and have them put on medication, and they don't need the medication, let's say they have an anxiety disorder, stimulant medication will make an anxiety disorder worse in many cases. And so not having the right diagnosis can cause a lot of problems. When a neuropsychological evaluation is not very well done, and the recommendations don't seem to flow from the results, or the case is not well argued, school teams will just disregard what is being said. And which then means that the parent really has an uphill battle to try to get the recommendations implemented in school. And if the report isn't well done, then the teacher really can't use it. And so again, it's like, well, what was the point in doing all of this? If the teacher can't help the child, the school team won't implement the recommendations, and so on. So it's really important to do it right the first time. It's a big investment of time and money, and so it's important to get it right. We see a lot of times recommendations that are uninformed by the knowledge of a child's legal rights to a free and appropriate public education. And so that's not very helpful in the IEP process. There are many neuropsychologists who will do the evaluations, write the report, but they won't observe the child in school or attend a team meeting. And so that often becomes a sticking point for getting the recommendations implemented in school. A lot of times school teams will try to avoid doing things that are recommended. And if a neuropsychologist is at the meeting, they're less successful in avoiding that than if the neuropsychologist is not at the meeting. And another thing that I often see is recommendations to professionals who, the neuropsychologist doesn't know. They just heard that this person was a reading tutor, but they have no idea if they're a good reading tutor or not a good reading tutor. And that can be problematic, obviously. So I think that this is my own sort of personal bias, which is that I think practices that are focused exclusively on the assessment of children and adolescents is really important, because even, at NESCA, we have maybe 9 or 10 neuropsychologists, and we only see children and adolescents, but each person here has a different area of expertise. So we have some people here that really specialize in autism spectrum disorder, some specialize in learning disabilities, some specialize in emotional issues, some specialize in adolescents, some in preschoolers. And so there's just a world of knowledge and experience to have in any one of those sub areas. If you then start throwing adults into the picture, it just feels like it becomes too diluted. Experience is key, in coming up with good recommendations and diagnostic work. At NESCA, we work very closely as a team. So we have senior people who have been here almost as long as me, 25 years or so. And then we have, younger professionals who are just a few years out of their postdoc and kind of everything in between. And we tend to work together, particularly on difficult cases. Group practice versus solo practice. We have case conference every week, and there's constantly a flurry of emails going around when people are looking for resources or want to talk about a case or something like that. And so there's sort of a collective wisdom in a group practice that doesn't exist in a solo practice. I think it's important to choose a neuropsychologist that has experience with children who are similar to your child in age and diagnosis. So for example, at NESCA, when somebody says, I want Ann Helmus to evaluate my preschooler who may have autism, I'll refer them to somebody else in the practice because that's not my expertise, it's not my specialty, and there's people here who do it much better than I do. And so that's really important. Experience in working with school systems is critical. Many times, the recommendations that we make for kids need to be carried out in the school system. And if you don't know how to work with the school system or you don't want to, that's going to be a disadvantage for the child. Another thing I would check out would be, do they have fee-for-service employees or permanent employees? So at NESCA, everybody here is a permanent employee of NESCA. This is their only job. I have a certain sort of culture and standards here that people are expected to live up to. People stay for a long period of time. Here, we don't have a lot of turnover. And so it's a very different work ethic than, come to the office on a Saturday and do this evaluation and we'll pay you, where people don't feel like they're part of a team or a culture, or that there are, certain standards that they have to uphold. What are the continuing education opportunities in that practice? So at NESCA, for example, every Tuesday morning, we have a seminar where we have outside speakers come in. We are constantly exchanging information about continuing education, lectures, all kinds of things that you can go to. And so, we definitely put an emphasis on continuing our professional development and education. So the cost of a neuropsychological evaluation, in short, it is high. It is a very labor-intensive process with people who have spent many, many years in school and getting their education. And so they are expensive employees, and that's reflected in the price. So one of the things that's important to understand is that some places split out neuropsych assessment from educational assessment, and they charge different fees for each one. So sometimes it can be misleading because they'll say, oh, the neuropsych assessment is only $3,800. But then if you want educational testing, it's another $1,000 or something. At NESCA, we always do the educational assessment because a child's job is school. And a lot of the recommendations that we make are going to have to be carried out at school. So there's sort of no way around that. And so our fees, which are listed here, cover that comprehensive evaluation, the neuropsych and the educational piece. I would say, as compared with other practices around here, we're at the upper end, although not the top, in terms of the fee. And as I've written here, it ranges from $48 to $5,400, depending on the experience of the clinician. Health insurance may cover part of the evaluation, but not all of it, because the health insurers consider a good chunk of this to be an educational activity, not a health activity. And NESCA does accept Blue Cross Blue Shield plans. They tend to cover maybe $1,500 of the evaluation. So when you are looking at a neuropsych report, the report should be comprehensible and meaningful to non-psychologists. So if there's a lot of jargon, then I wouldn't consider that to be a great report. And the report should have all the test data with the behavioral observations, as well as the interpretation of that data. If there's a diagnosis, it should be clearly stated and substantiated. What was it in this assessment process that supports the diagnosis of an anxiety disorder or of ADHD or learning disability? Understanding the developmental risks associated with the profile is really important. So just as one example, girls who have communication disorders, so they struggle either to express themselves verbally or to process language or both, Oftentimes will do fine socially when they're younger, because a lot of the socialization when they're younger is running around and not using a lot of language. But these same girls are at risk when they hit middle school or in the upper elementary years for struggling socially, because the socialization switches from climbing on the jungle gym and running around to standing in groups of girls and talking at high speed. And so for parents to understand that, they sort of have a roadmap of where things may be going. The recommendations should respond to the child's program, and we should always be thinking about where is this child, how is this child going to launch into young adulthood? So these are all things you can look at to see if it's a good quality report. We're starting to run out of time, so I want to just sort of go through these quickly. So the behavioral observations is a section of the report where we describe what's going on with the child's behavior. And then, as I mentioned, the test results and the impressions section of the report is the integration of the information from the child's history, the observations, test scores, the process by which they got those scores, and so on, to generate a picture of the child. That's the first thing. We want to say, who is this child? What are their strengths? What are their weaknesses? And how does this impact their functioning in the world, socially, academically, in the family, in school, and so on? That is the goal of the neuropsych evaluation. Then we think about, is there a diagnosis that describes this profile? Because that can be helpful for insurance coverage, for IEPs, for finding the right section in the bookstore at Barnes & Noble. And the impression should not just be a summary of all the test scores, which I often read. It's just sort of a reiteration of what we already knew from the tables. I just talked about the risk statement. And let's see, those are recommendations. So I just wanted to end with, this is a very good book written by Ellen Broughton, who's a neuropsychologist at Mass General. And this book has a lot of very easy to read and understand information about all the different tests that we use. And so I would recommend this if you're having your child evaluated, so that you can really understand what the tests are, what they're measuring, how they're scored, and so on, as you're trying to sort of make sense of the whole process. So I'm going to stop there to take questions if there are any.
Hi there. So we had one question about whether or not the presentation will be available afterwards. And we will be posting this to our website, and that is www.nesca-newton.com. And it will be in the resources tab, and then there's a video resources as well. So we have a question. You talked a little bit about what your specialty wasn't, but could you tell us what your specialty is?
Believe it or not, people say I'm crazy. My specialty is adolescents. Love working with adolescents. And really like looking at the interplay of emotional issues and learning issues, and also have a special interest in nonverbal learning disability.
Great. And how frequently would you recommend testing, typically for a grade school child with a diagnosis of ASD?
That's a great question. And it's really hard to sort of generalize, because it depends on the child's functioning, what's being put in place. So for example, if we tested a child and recommended a change in school, we might want to do more frequent testing to figure out if the new school was working or not. So it's really hard to say, but that's a question that you would discuss with the neuropsychologist. Certainly more often than every 3 years, as the public school does it. So sometimes with kids, when I'm just getting to know them and we're just trying to get everything straightened out, I'll see them maybe 2 years in a row. And then we'll go to every 18 to 24 months.
Great. And what is the youngest age you recommend doing an evaluation? If a child is already on an IEP and getting services, is there any reason to get one?
Yes, so I'm going to answer two parts of that question. There are clinicians here at NESCA who I'm completely in awe of, who can evaluate 1.5 to 2-year-olds. They're obviously not giving the math test, but there's a lot of infant development scales and things like that. And so they can really pinpoint language development, motor development, attention, emotions, all that kind of stuff. And that can often be really important, especially if there's possibility of autism as a diagnosis. If a child is identified by the school as having a disability and they're on an IEP, it still can be extremely helpful to have a neuropsych evaluation because it serves almost as a second opinion, right? The school may or may not have everything right, or the school may be offering services that are the services that they have in-house and that are convenient to offer, not the services that the child actually really needs. So it's, you know, the school has a vested interest in some ways because they have to pay for anything that that the child needs, whereas the neuropsychologist just looks at the child and says, you know, this is what's going on and this is what the child needs, which prompted a special ed director to say to me at one point, in my next life, I'm coming back as an independent evaluator, a neuropsychologist, so I can make tons of recommendations and not have to pay for any of them. Yeah, that's what I get to do.
What do people who need a neuropsych evaluation for their child do if they can't afford one?
Great question. There are some centers like I believe it's called the Brennan Center or Brenner Center. Do you know, Jane, over at William James College?
I thought it was Brenner, but let me just check.
Yeah. So William James is a graduate school for psychologists, and they have a center there where they do free or very low cost evaluations, and the person who runs it is great. So they do good quality evaluations. The hospitals often take much more insurance than NESCA does, and so that may be a possibility. Sometimes, depending on what your process is with the school, you can get the school to fund an independent evaluation. We write a lot of contracts with schools to see kids, so that's another route that you can go.
And it is Brenner, brennerchildrens.org.
Okay, great.
Can you identify, or can you give a name of a test which can help identify comprehension issues in any kind of auditory issues?
So at NESCA, we use the wide range assessment of memory and learning. And so there's some language testing in there that we look at to see if kids can follow sort of connected text. There on the NEPSI, which is a battery of neuropsych tests, there are tests like comprehension of instructions to see if kids can follow multi-step instructions. So there's a range of different tests that we use. Depends on the age and what the suspected deficit is.
Okay. I think those are all the open questions we have at this time. Are there any last questions coming in? All right, I don't see any at this time. Certainly, please do feel free to reach out to me if you have any questions that you think of at a later time, and I will be sure that those are answered for you. And thank you all for your participation, and have a great night.
Great, thank you very much.
Take care.
Thanks.